My guest on the line is Dr. Kevin Pho, co-author of the book Establishing, Managing, and Protecting Your Online Reputation. You can get more information about that at kevinmd.com. So, Kevin, let's kind of just dive into this now. So, when you talk to physicians and hospitals and things, specifically about getting to know and learning about their online identity, what do you tell them?
I tell them that they should Google themselves because that's what patients are doing. And I say that people should Google themselves once a week. And when I say that during my talks, I get a laugh. But it's, in all seriousness, that's really the first thing that they should do. And there are some doctors who are shocked at what's being said about them online. A lot of physicians will have profiles already written about them from third-party sites, from a Health Grades, for instance, or a Vitals, and they may not know it. It could be from a media story where they were quoted, or worse, it could be a negative patient review from a Rate MDs. So there is already a lot of information written about doctors, and they didn't have to do a thing to get those things written. So that's the first thing I tell medical practices and hospitals is that they need to find out what's already being written about them. And then once they do, they can chart a course on how to correct that or how to create content so they can define themselves online.
And I get a lot of those questions as well. And most common questions I get is, Mike, how do I take that off? And how can I get people to remove that? And when you talk to hospitals and physicians, you tell them a little bit different strategy in trying to accentuate more of the positive to increase and try to drown out some of those negative feedback. Would that be correct?
Yeah, certainly that's one technique, and absolutely. I think when you say that a lot of doctors want to, how do you remove the negative review? The bottom line, as you know, is that you can't. There are very few lawsuits that have been successful in terms of removing a review, and if you talk to these sites, a lot of these sites will say straight out, we're not going to remove any negative reviews. It's going to infringe on that patient's right to free speech. So the technique that I like to use, and a lot of other physicians online use, is to be proactive. Don't be reactive. Don't wait for that bad review about you. Why don't you be proactive and generate that positive content about you in the first place, and use that as a buffer for anything that may come in the future. And the pushback I get from doctors when I say that is that I don't have time. We're busy. We're around the hospital. We see 30 patients. We have to do pre-authorizations. We just don't want one more thing to do. And I'm a primary care doc too, and I certainly get that. And I'm not saying that these healthcare professionals need to use social media to the extent I do or to the extent you do. But a simple act like creating a profile on LinkedIn, that's the social media site that I like the best. There have been studies where they've compared the different platforms, and LinkedIn actually has the highest rank on a Google search engine page, and it's synonymous with being the professional social networking site. And you can spend about maybe 15 to 30 minutes and putting in the equivalent of your online resume and list your professional achievements and where you practice. And the key is that profile will get ranked high when your name is Googled, and that's one way to build what's called a digital footprint and push down any of these third-party sites that may have less flattering things or inaccurate things about you. And I think that simple step, which takes about 15 to 30 minutes, is tremendously powerful. And I think every doctor should spend that time to do that minimum. And if they don't have time to do anything more, they're already ahead of the curve. That LinkedIn page can be static. But if they decide to go further and explore the other social media platforms and use it to do what other doctors do, connect with patients, curate information, I think all the more better. That's only going to increase their digital footprint. But I am a proponent of creating content and being proactive when it comes to defining yourself online.
And you may have said this already, but you've said many, many times that doing clinical work on social media, doing patient care is definitely a no-no. Is that correct?
I always say that social media is great to speak to patients collectively, but never individually. I don't think it's evolved to a point where you can give one-on-one personal information I get questions, and I'm sure other doctors online, they get questions on Twitter or they get questions on email from people they don't even know. Doctor, I'm having chest pain. What do I do? And absolutely, social media is not the venue to address these type of individual concerns. You need to tell them to talk to their own doctor or at least take that conversation offline, because it hasn't evolved to a point where we can give that one-on-one information. But I do think that social media is a great way to speak to patients collectively when it comes down to dispelling medical myths or giving our commentary on the latest health guidelines or giving our thoughts on breaking medical news. I think that social media is a tremendous way to transmit that information, because patients are consuming information in different ways, whereas television and newspaper used to have a lot of influence back then, but now there are people who only get their information on Facebook or only get their information on Twitter. And I think it's important for medical professionals to have some type of presence in these outposts as well.